Next, I'd ask Ms. Zisk to come forward. As you know, we've spent an awful lot of time over the last 2 years working on the opioid settlement, and Francine has put together a presentation to talk about the recommendations of the committee. So Francine, I turn the floor over to you.
Good morning. It is a privilege to come to this point where Bridging the Gap Subcommittee has provided recommendations. I am going to discuss what the recommendations are that the committee came up with. Background, in 2023, we completed a community needs assessment. It says completed in 2025. We used some of that data is actually completed at the end of 2023. We utilized local data, national data, needs assessment, and summary and recommendations. If you recall, at the board meeting, it was presented in November of 23 about a lengthy presentation of what was discovered. Along with that, we also had a town hall meeting and 2 book reads in the community to bring awareness to substance use disorder and to get a feel from the community of what was needed. Just a highlight of some of the drug data that was found in the community needs assessment. We utilized from January of 21 to September of 23 of what drugs were obtained by Michigan State Police. We took these, every drug that was collected, to a unit of measurement of a single substance. 3,217.15 units of measure. 77% of these drugs were stimulants, including methamphetamine, cocaine, and crack cocaine, which was different than what had happened 5 to 7 years ago, and that was found in the community. 9% were opiates and narcotics. So of the opioid settlement funds, we were starting to call this substance use disorder as because the drug started to change and what was seen in the community. We also went with the medical examiner's report, substances found in the body at the time of death. 30 had a stimulant in it, 15 opiate-based, and 5 other substances. We conducted 175 assessments. Some of those, I think it was 32 or 34 that were in the Lenawee County Jail. The rest was from the community, the town hall meetings, and people who were doing this work. So the alarming drug data wasn't exclusive to Lenawee County. It's what we were finding on the state and the national level, that stimulants were growing what was found in the body at the time of death. What we've saw in a decade of differences is back a decade ago, there would be prescription drugs found present in the body at the time of death. Now the growing trend is they're illegal drugs. So we're removing, which is showing that the opiate settlements and all the laws that were presented for drug prescribing are working. And now they have been moved to illegal substances. So in this community needs assessment, what was found with the participants' information, according to people who had lived experience suffering from substance use disorder, these were the ranking of what was needed in the community. According to community partners and community members, this is what was found. With the information and what was happening in the community, it was recommended that we create a recovery housing committee. That committee was appointed. It began in February of 24. We brought in 6 different housing groups that deal with people with substance use disorder. And the committee at the end, after listening to the housing groups, did not want to move forward and fund recovery housing. The committee wanted to come up with what are the gaps in the community? What did the community needs assessment not meet? And what was needed best served in Lenawee County? We came up with Bridging the Gap Committee. It was appointed and began in March of 25. An RFP was created and was released for proposals with Exhibit E documents. Exhibit E is the driving force document that dictates where the opioid settlement funds should be spent. Bridging the Gap meetings, we received 27 proposals. We heard 23 of those proposals over 7 months. Some people rescheduled, some people withdrew, and some people just did not show. There was a recommended programs for a holistic approach that would best serve Lenawee County. For the monies that has been received thus far, 1.5 million was allocated in this rounds of RFPs. Through the committee meetings, there were surveys done, a lot of conversation, and the following is the recommendations from what the committee came up with to best serve Lenawee County. The first is with Catholic Charities. Their program is called Seeking Safety. This program provides an education program to assist parents with substance use disorder, CPS. It's an evidence-based program conducting 10 individual sessions, groups of 8-week sessions, up to 12 times per year, was in their RFP proposal, and that's what they stood and stated that they would accomplish. As you can see, every one of these programs also has what is presented and services under Exhibit E. This program will be for 2 years. Their funding request was for $72,040. Parkside Counseling, they have 3 proposals that are recommended to be funded. The first one is exclusive for youth prevention and intervention programs. These services include individuals, family, and group therapy. These are the Exhibit E that they had multiple sections that this covered. Program is for 1 year, $251,390.50. The second proposal was Reset for Success. This was to connect and motivate success also for you. Alternative to suspension program, and this is collaborating with the school districts to pilot programs to connect parents and youth involved to connect that and give them services with counseling and therapy with other alternatives. Program for 1 year, funding is $144,420.64. The third proposal for Parkside, engagement for all, especially for adults who have no insurance, commercial insurance, and do not qualify for traditional substance use disorder services through CMH funding. Exhibit E is listed there, program for 1 year, funding of $36,633.20. U-Turn Health. This is a out-of-county program, and it will be done through tablets and online video-based education. This is evidence-based, person-centered program to support individuals with not only opioid use disorder, but substance use disorder. This access is online, several hundred videos. They do have a workbook format that they can use as well for a lot of different coping strategies. U-Turn Health will be provided for anyone in community along with their families. When they first submitted an RFP, it was for justice impacted people only. However, that was revised to include everyone in the community, being inclusive for everyone who is in Lenawee County and their families. This program is for 2 years, funding of $189,498. Family Medical Center program to support medically assisted programming, adding 45 to 50 new county residents who are suffering with substance use disorder through MAT. These are the exhibit that is funded, they meet the requirements under. Program is for 1 year of funding of $200,000. Impact marketing. This marketing was for media campaign. Impact marketing came in when they did their presentations, they provided a lot of examples that they've done marketing for, specific for counties that made a difference to reduce overdoses and reduce substance use disorder in their community. If you're looking for a specific idea or niche that you want to do, they will blend that with all of the programs that will be serving or be funded under the opioid use disorder monies in Lenawee County. And they will target that and work exclusively to come up with efforts that will help and assist. Here's the exhibits that it's covered under. Program is for 1 year, $99,273.40. Inmar, this is a program that provides kiosk stations for medication, along with placement, including mail-back programs and sharp containers. As we do have drug take back, there was a lot of discussion regarding this. The thing that became very interesting is they have mailer back programs that people who are in rural areas that can't get somewhere can mail their medication back, which includes sharp containers that are not available only for certain 2 times a year. This program is for 1 year. Funding is $44,250. McCullough Vargas and Associates. Proposal is for peer recovery coach. The expansion is to serve in peer recovery for incarcerated people, unhoused, domestic violence, and medical care connected to treatment and support. Their programming was written for 1 year. However, if they do not expend the monies, they will go up to 5 years to utilize the $165,000. Lenawee County Sheriff's Office, proposal for funding to acquire medication for MAT services in the jail to provide classroom-based education to the inmates regarding their SUD, MAT, and MOUD program. Program for 1 year, funding of $75,000. As you hear is a list, and the final total is $1.277505.75, coming under the 1.5 million, which will give area in the future if there is any other programs that can be negotiated and to be funded that can assist with any of these gaps that were not recommended. And with that, Commissioner Martis, would you like to end this as you served as the committee chair?
Well, certainly. And first of all, we have to say thank you to Francine. The volume of data that Francine had to work her way through, the length of these proposals, the intricacies of Schedule E is something that a judge would have to sentence me to deal with, because it's just not my wheelhouse at all. And Francine did a fantastic job putting this together and helping us all understand it and managing all the details. And I also want to mention the members of our committee, Judge Todd Morgan, Health Director Monica Hunt, Deputy Medical Examiner Sarah Palmani, local businessman Gary Clift, former State Rep Brana Colley, Commissioner Terry Collins, Sheriff Troy Bevere, myself, and Community Mental Health Board Member Tim Kelly. I've said this several times. I'm just a remodeling contractor that tried to pay attention in school. These people brought tremendous depth of experience and a real commitment to this. We were meeting twice a month for a number of months, and I think the second meeting of every month was actually 2 hours long with back-to-back presentations from these folks. Tremendous lift, complicated thing, and Francine and the team have done a fantastic job. The focus that we placed on is, because initially the previous group had a focus on housing, and it became apparent that that was not a direction that we were going to move forward with. Jim started then the Bridging the Gap Committee, and I picked it up in July, I think, or August. Had to hit the ground running, get to know the team, but it was clear that people wanted to make sure the resources were being committed in any way possible so that we're connecting people who can bring help to people who needed help. That we saw that as the most important item. And there's a number of ways to do that, understanding that we have some people who are school age, some people who are out of school, some people who have insurance, some people who don't have insurance, some who are justice involved, some who are not, some, I mean, there's a whole range of issues. And then of course, their family members who have another host of issues. So trying to find a way to plug all those gaps in a way that we haven't had the resources to do before has really been our challenge. The next thing is we were pretty confident we did not want to invest money in bricks and mortar and that kind of thing, and medically assisted treatment, which some of you may not know. There's certain drugs available that if you have an addiction issue of some kind, these things can blunt the effect of medication or of the substances for a number of days. Some of them are quite cheap, some of them are quite expensive. But there's been an issue with finding funding for that. It was obvious that was a component that we were going to need to look at in some form. And then finally, something we don't think about, but we have existing programs plus new programs, but they're no value if people aren't aware of their existence. So we realized that some kind of marketing campaign was going to be important and play an important role in this. And I have to say we had 2 very good proposals, but the group that we went with I mean, I'd encourage you to go back and watch the video. I mean, talk about an impressive presentation, and marketing is only as good as the content that's created by the creator. Everybody can use a web service, everybody can put it on Facebook, but if the content isn't effective, and this provider brought meaningful numbers showing a change in outcomes in the communities where they've been doing their work. So that's how we kind of settled on these issues in the proposals that came forward. And actually, there's quite broad agreement on virtually all these. We also understand, however, with humility, that this is our first attempt at this. I mean, we have 1.5 million that we're working with now. This is kind of our prototype approach. We're praying that we get a 70 or 80% success rate. But to make sure of that, that's one of the reasons that we're looking at reconstituting the Human Services Committee, because we need an entity for these groups to report out on their progress. And we didn't think the Bridging the Gap Committee was the right entity for that. These folks have a lot of other things to do in their life, and they don't have the authority that the Board of Commissioners do. So that's going to be an important mechanism to make sure that these folks are following through on their contracts. And then, of course, we have millions of dollars in the pipeline still, which means this whole process will start over the course of the next few years. Hopefully, with the feedback loop from the things we're doing, we're going to have a sharper idea yet of how to continue to focus resources, and hope that we get, additional proposals that'll be of great value. So any questions on that before I go into the details of the request? Jim?
No, just a couple comments. I mean, I guess one of them, are we questioning at this time some of these expenditures? Because the only one I don't understand on here is the McCullough Vargas and Associates. The rest of them all have a deadline of year, year for duration, but on the McCullough Vargas, it says 1 year up to 5 years. If you spent $165,000 in the first year, would there be $165,000 for them the next year and the next year?
No, not as it currently stands.
Okay, so it was just 107. And then I just want to thank you, Commissioner Collins, Francine, speaking on behalf of this committee, because I served on the housing part of it, and I want the people to understand that it isn't that when we say that we didn't want any part of housing, it isn't that we didn't want to look at how housing might support the system from other organizations. It was that we don't want to own a building for housing and moving it forward, and that's what put us together with this second committee to see what some of the other areas are. And I'm going to watch very carefully, because I like the human services idea and them coming in to report, because we need to monitor these to make sure that, I mean, there were a lot of good proposals. You guys did a great job of analyzing them. Now we got to make sure that they're supporting what they said they were going to do with the amount of money that we're giving to them. So I just appreciate the committee. The committee just did a wonderful job.
Can I give feedback on that? For your second portion of to monitor, one thing that was crucial in the RFP that came through in every of the presentation was what was the sustainability in the community. Because the intention for Lenawee County wasn't to put an RFP of a one and done that you received the money, right? Is what is the sustainability? Because that's going to impact the community more than anything. So that was something that was apparent in the RFP, and hopefully will be in the contracts as well, as that sustainability, because that accountability and reporting is going to be important. Is this going to be sustained? And I believe Commissioner Collins asked that several times. What is the sustainability going to be in this program?
Right, thank you.
And I would add that with respect to housing, it is a value for many of the people on the committee, but we understood it would take a tremendous amount of capital, and it's a struggle to maintain that for the long term. And what we said to some of the proponents is, over the next few years, if you can find a group of stakeholders and a pool of assets that can be committed towards something like this, it's certainly something we might at least investigate the option of partnering with them. But to commit a huge percentage of these resources to that area was not something that the committee felt committed to, but we certainly value the concept and the need. Anything else before I explain the proposal? Thank you, Francine.
Thank you.
So we have a host of these proposals, and they vary in dollar amounts. Some are $45,000, some are hundreds of thousands of dollars. Some might need their funding up front. Others, it would be obvious that we'd want to distribute over time. Rather than bringing 8 or 9 contracts before us and working each of those out one at a time, what this proposal is recommending is that we appoint well, I'll just read this out loud. This action ensures the timely and efficient allocation of funds to qualified programs that address identified community needs through the Bridging the Gap initiative. Granting negotiation authority to a designated team will streamline the process while maintaining appropriate oversight and accountability. The Bridging the Gap Committee requests approval from the Lenawee County Board of Commissioners to fund selected programs that have completed the RFP process. The total funding allocation for these approved programs shall not exceed $1.5 million. Additionally, the committee requests authorization for a negotiation team consisting of Board Chairman Van Doren, Commissioner Collins, Commissioner Martis, and County Administrator Kim Murphy. This team shall be granted authority to negotiate final terms, scopes, and funding agreements with selected program applicants consistent with board-approved funding limits and county policies. Funding for approved programs will not exceed $1.5 million and will be allocated from the opioid settlement funds. So the request is, we recommend that the Lenawee County Board of Commissioners approve the funding of selected Bridging the Gap programs not to exceed $1.5 million and authorize the designated negotiation team to finalize the agreements. Is there a motion to that effect?
Support.
Okay, comments? Commissioner Stimson.
Just so I'm understanding what that motion means, that group of people will then be required to authorize only the contracts of the approved proposals?
Yes.
So 2 years from now, if company XYZ comes forward, this is not an approved person who can come forward.
That's correct.
Additionally, it would be for only an annual year because all of these proposals are for 1 year, that the renewal of it in a year wouldn't just automatically go to that subcommittee.
Were not some of these proposals 2 years in length? Yeah, so some are 2 years.
On this, I see only one that said beyond a year, I thought. Did I miss that?
Francine, do you want to come back up?
And I've got a whole bunch of other questions. Is this something we have to vote today, or can we review the actual proposals? I'm sorry, there was Catholic Charities and U-Turn Health were also 2 years, I thought.
Right.
Does this have to be today? Because I haven't actually read any of the physical proposals because they've never been provided to me. And so this is $1.5 million of taxpayer money coming in through the opioid settlements, a third of which seems to be going to a private company that the courts don't use any longer.
Well, I would say that all the proposals, were they all in the packets over time? So all the proposals have been available on the Bridging the Gap Committee packets.
But I'm not on the Bridging Gap Committee, and neither are most of the people in this room. And so is there any reason we can't delay a month so we can review those proposals? I can read the actual proposal for what they're going to do for youth intervention in a school, as it's been something that's been dealt with on a regional and state level for the last 10 years, specifically with substance abuse. Ralph and I sit on that committee, and we've been dealing with the in-school use of that aspect of some of their programs. I want to see how that works, but I've never seen those proposals from Parkside. And particularly with our court system moving away from Parkside because of some of the concerns they've had. I just want to see how we're going to measure their outcomes and things of that nature. And I don't think we're harmed by waiting a month so that we can read all that.
Commissioner Van Doren.
I understand that, Dave. One of the, and I'm not sure about waiting. I mean, what time period are we looking at here?
Month.
A month to take a look at it, because the one thing we do want to do is this money's been sitting here for how long?
It's been slowly trickling in over the last year and a half, 2 years probably.
Yeah.
Go ahead, Francine.
Since 2023, actually, we received money before I arrived in May of 23. So
yeah,
it comes in until 2040, and that keeps building with the new settlements that come through. Lenawee County, I think we're at 5.7 million that will be coming in, but that'll be more when we finally get a couple of the larger settlements.
Anyway, so we just want to get this thing up and moving, because we, had that one committee for housing that took up 12 months, and then we appointed this committee that's taken another 12 months. But, and I think part of what you're looking for here is the evaluation and recommends that, those aren't in their contracts, are they? How you're gonna measure it? Isn't that part of the negotiation of the contract?
Well, that's it. We have their proposals, but then we need to go back with them and negotiate things like, okay, you wanted $200,000. We're not going to give you that up front. We think that should be distributed to you quarterly, and that needs to be added into the contract, the final contract. One that was 45,000, however, which includes kiosks and mailers and Sharps containers. Of course, that would make more sense to fund up front because virtually all their money is going into hard deliverables. So because each one has those vagaries, we thought it might make sense to have a team of commissioners and Administrator Murphy resolve those final details while staying inside the budget approved here. Commissioner Collins.
This committee was tasked with the job of receiving these presentations, receiving these programs, and making a decision that we were to bring to this board. We have done that. To say in a month's time that you're going to go through 26 proposals and the information from 26 proposals and not have the benefit of a hearing from the individuals who make those proposals, I think is being unfair both to that committee and to this board. You'll not have time to do it in 1 month, 2 months. I don't see that happening.
Any other comments? Commissioner Stimson.
I think my request is simply to see the proposals that are being requested to be funded so that I can understand their measurables, so that I can report out to my constituencies what that's supposed to look like. And so I don't think something that's taken almost 2 years is harmed by allowing those proposals to be disseminated, of the recommended proposals, and allow us to read those so I can ask questions about that, Terry. I'm not trying to second guess the committee. I'm not trying to say that they're right or wrong. I'm just simply saying I'm looking at a third of the funding going to one agency, a private agency, unlike most of the other ones, which are all nonprofit agencies. That knowing that owner of that agency and the size of that agency, that probably makes up a 50% of their total budget, maybe. I mean, that's a huge increase to a small little agency. And so I just want to know how they intend to track parameters like outcomes, which has been something they've struggled with in other programs. So I'm curious, as a person who's about to approve of $1.5 million of funds to a private company.
Any other comments? Commissioner Van Doren.
And I hear you, Dave, but I have to, and agree with Commissioner Collins here to some degree, because we were hopeful. I mean, these reports were coming back to you every month when we were having a meeting with Bridging the Gap and asking if there was any questions. And each time they were doing that, the proposals were put into the packet, and we were hopeful people were following along because we thought exactly that. I mean, it's going to be one thing to appoint this committee and have them come up with a recommendation and then negotiate how we're going to measure that and move forward to make sure they're moving it forward and not have everyone coming in and second guessing how we need to. We could spend another 6 months on this if we go back and review it and people have all kinds of questions. I mean, I think that's what we expected the committee to do, and we expected people to follow along as we were going. So.
And I think the concern about their performance will be addressed in the verbiage of the contract, because we will be monitoring that. And if we see performance issues, we will have contractual authority to take up further discussions with those providers at that time. So we have a motion and a second on the floor. All in favor signify by saying yes.
Yes.
All opposed, no.
No.
Motion carries. Thank you.